everyone. Welcome back to the Concussion Discussion Series brought to you by Integrated Brain Centers. I am your host, Amy Zellmer from Faces of TBI, and today I am here with Dr. Kelsey Brenner from the Neurologic Wellness Institute, and we're going to be talking about concussion and QEEG guided neurofeedback. So I'm really excited to have you here today, Dr. Brenner, and it's a topic I don't know much about. So I'm really excited to learn more about neurofeedback today.
Awesome. Thank you for having me. I love talking about it, so it should be fun.
So tell us, maybe in a nutshell, what is neurofeedback? I've heard the term at a basic level. I kind of know what it is, but what is neurofeedback?
Sure. Very simplified, short answer is neurofeedback is a therapy that helps guide the brain, kind of shifting it closer to a normal or average activity. We've all heard about, I would think, brain waves. And so after certain, accidents, like having a concussion or an illness, sometimes our brain waves can kind of get out of line, or we can have too much of something or too little of something. And neurofeedback helps bring that closer to normal and kind of brings back some of those symptoms that may have been occurring because of those abnormal levels.
Mm-hmm. And so what are some of the symptoms that you see the most benefit from with neurofeedback?
Sure. Yeah, I would say a lot of times it's, we see brain fog, focus, concentration issues, sleep abnormalities, anxiety, or kind of like mood changes. Those I feel really benefit from neurofeedback. I can usually, if someone tells me their history, I can usually kind of say, okay, but I know what their brain map's going to look like, just because it's very common, and we can see that on there if they have too much of certain activity, and then we can bring that closer to normal. And those are the symptoms that really respond well to that type of treatment.
Okay, so you just mentioned brain mapping. So let's maybe jump there for a moment, because that's a term that's kind of a buzzword right now, is brain mapping. So maybe let's kind of jump into that. And what is brain mapping, and what are you looking at? Like how do you map it, and then what does it look like? What are you seeing on the results?
Sure. So yeah, that's where everything starts. So in our clinic, all of our patients, when they come through for diagnostics, they all receive a QEEG. And what that is a quantitative electroencephalograph. Big words. We've probably all seen EEG, especially video of the old school EEG with, ink pens, and they scribble across a piece of paper. That's just looking at the electrical activity of the brain. We now have, advanced technology where we can digitize that process. And so when patients come in, we put a cap on their head, a little bit of a saline solution just to get a good connection. And then the software just reads the electrical activity coming from the top surface of the brain. That gets turned into an EEG on my screen. I can see the raw EEG data. And then from there, I take that information, I put it through a software, and that's where I get this brain map, or QEEG. And all that means is it's taking that raw EEG and comparing it to a normative database of patients of that similar age group who have been considered normal or average brain activity. And then from there, we can say, okay, do you have an increase or a decrease of a certain activity? Where is that happening on the brain? And is that associated with, any of the symptoms that you're having?
Mm-hmm. Yeah. And so what does that look like to you as, from the doctor's perspective? Are you just looking at little squiggly lines, or is it a little more complex than that, what you're seeing?
Yeah. So first I look at the squiggly lines, which is the raw EEG. So I always go through that first. I want to make sure that we have really good, clean data. I want to see if there's any, blatant abnormalities there, any epileptiform, moments or anything like that. And so I check that first, and then the QEEG is actually a big report. Some people have probably seen these big colorful graphics of the brain. And then there's usually a lot of other, information on there as well about, how standard deviation, how far from normal they are, a lot of different information. But the thing that we present to the patient is usually that big, pretty colorful graphic of all the little brains on the screen. And what that means, it separates the brain activity into different bins, which these are our brain waves. And so you have delta, theta, alpha, beta, and gamma. And those are just ranges of brain activity going from slowest activity to fastest activity. And these colorful brain maps kind of take that information, split it up, and that's how I can see and how the patient can see, okay, if I have, an area of red and over here in delta, I have too much of this slow activity. Or if I have a blue area here in alpha, I have too little of that alpha activity. And so it just gives us a range of, how far from normal they are and if they have an increase or decrease of that activity.
Mm-hmm. And then is this, I would have to assume this is really validating for patients to show, like, here's physical proof of what's going on in your brain. And yes, I understand why you're struggling with XYZ.
Yeah, absolutely. I mean, you don't want to tell anybody like, here's an abnormal activity happening in your brain, but, a lot of times it's just like, oh my gosh, like that's exactly what I'm feeling. A lot of patients, they have brain fog and they see the increase in the slow wave activity, or they have anxiety and they see this fast activity, and to tell them like, it's going to be really difficult for you to, decrease that sense of anxiety when your brain's just going too fast. You can't meditate it away. You can't supplement it away,
Right.
Like it's just going too fast, and you're going to have that sense of, racing thoughts, difficulty controlling your emotions. And so when patients see that, it is a sense of relief. Like, okay, like I've tried so many things, but it's not me that's not working hard enough. Yeah. My brain's just literally stuck like this right now.
Mm-hmm. And how long, so they put the cap on, how long does it read those brain waves? Is it like a minute or 20 minutes?
Mm-hmm. So we do different tasks. So we'll do, once we set up the cap, we'll do about 3 minutes with their eyes closed, just resting. We'll do 3 minutes with their eyes open. And then we may also do another 3 minutes, possibly with a task. So maybe reading a book or doing a math problem, to see, different brain states, because there should be a different activity based on those brain states. And so we want to see what they look like in those different areas. So it's a pretty quick, easy, non-invasive test.
Yeah.
And then I do the job afterwards of having to analyze the information.
And how would this compare to like a functional MRI or a SPECT scan?
Sure. So this is when I take a QEEG, I'm getting, a solid picture. Whereas a functional MRI, a lot of times they're giving a task and they're seeing the activity happen in the brain after that task, and it's a little bit more dynamic. And they can also see a little bit deeper structures. They're also looking a little bit at more blood flow, different things like that, where this is looking a little bit more at the surface, although we have other technology with the QEEG where I can look a little bit deeper called Loretta. And so it's just a little bit more static versus dynamic type of looking at the activity. Yeah.
But you're getting sort of the same, similar information.
Similar, like understanding all these modalities are looking at function of the brain, whereas when you're looking at like an MRI or CT, you're looking at like actual structure. So that's the similarities with that for sure. And, if somebody were to get a fMRI or SPECT scan and then also do a QEEG, we'd probably find similar areas of the brain that are showing abnormalities. We're just getting a little bit of different data.
Mm-hmm. Yeah. And so then with this data, what are you then able to do?
Sure. So once I get the QEEG, sorry, my screen popped up. There we go. Once I get the QEEG, I present it to the patient. We discuss it. In our clinic, we have a lot of different practitioners. We do a lot of different modalities. And so we combine a lot of things together and we figure out, okay, what's best for this patient in this case. And if we think that neurofeedback, the treatment portion of it would be applicable, then we create a treatment protocol. And so that's going to be based off of the QEEG. It's going to be based off of, their history, other things that we see on their other diagnostics. And so based off of that, I say, okay, do we want to increase or decrease these certain areas? And how do we want to give that feedback to the patient? So the patient can either get, they can either have neurofeedback with their eyes closed, maybe listening to something like music, or they can have their eyes open, watching something on a screen. They could be playing video games with their brain, which kids love that one. So it's all about just finding the feedback that we want to give that will engage the patient, but then also put them in that brain state that we're trying to target that activity.
So maybe explain that a little bit further, the brain state that you want them in.
Sure. So, if I'm doing the QEEG and I'm looking at the eyes closed QEEG and I see, they have an increase in beta with their eyes closed, I may say, okay, I want to, that's going to make it difficult for you to fall asleep at night. It's going to make it, you're probably having high anxiety in that state. And so I'm going to want to train you in that state. So I'm going to have you have your eyes closed. I'm going to put music on. And then the software creates a program of where I want to train your activity to. So for a really long time, back in the day when neurofeedback just started, it was really centered on something called amplitude training. And what that meant was if you're looking, they really didn't have QEEG back then. We just didn't have the databases. And so they were looking at the raw EEG. And so they were saying, okay, based off of this raw EEG, you have this increased beta activity. I want to decrease that, but we didn't have normative databases to say, okay, decrease it to what? And so now with these QEEG and these standardized databases, I can say, okay, I want to train you towards this normal or average range based off of your age group. And so the software reads that and says, okay, anytime that you fall within this range that we want you to be within, then you're going to be able to hear the music play clear. Anytime that you start to produce that excessive beta again, it's going to dim out. And our brains are selfish and they want reward and they want to listen to the music. And so it realizes that, okay, when I do this certain activity, I get to hear the music. I'm going to reinforce that activity. And that helps bring down that beta and pushes them closer to that normative range that we want.
Mm-hmm. And now how would that work with something with eyes open? What would be an example?
Yeah, so eyes open could be, they could be watching, a movie or something on the screen and it'll dim in and out. So if they're having excessive beta, it'll be dark. If they're where we want them to be, it'll play nice and clear. A video game, they'll, they're shooting like 3-pointers in a basketball game, they'll start getting a lot of points. If they start producing that excessive beta, all of a sudden they start missing. And so it's all about training the brain to find the state that we want it to be in and then reinforcing that good behavior so that it repeats that behavior and kind of sticks in it.
Mm-hmm. Yeah, that's really cool. And is this also called biofeedback or is that a totally separate entity?
No, so biofeedback would be the large topic, you could say, and then categories. And then neurofeedback is biofeedback of brain waves. Okay. So you can call it biofeedback of, the brain, brain waves, or neurofeedback. So it's biofeedback is just using any form of biological event. It could be heart rate, muscle tone, brain waves, and giving feedback to the body to change that biological event. So neurofeedback just falls within that broad category, but we're just addressing more of the brainwave side of it.
Okay, that's fantastic. Yeah, it's super fascinating. And I've had friends who have had what they call biofeedback, but I'm realizing now it's the same thing, they were doing neurofeedback.
Right.
So, super cool. And, it all relates in with functional neurology and how, we're retraining the brain to go back to its efficient route or its efficient system. And so I can see how this is such a complementary practice within what you guys are doing at the Neurological Wellness Institute. And just, having that one extra level of, being able to see what's going on with the QEEG and then having this neurofeedback system to just, like you said, your brain likes to be rewarded for doing the right thing. And so it's just, you're getting that neuroplasticity going. And yeah, so, how does this all integrate in with everything else you guys do at the clinic?
Yeah, for sure. So honestly, it's what got me into neurofeedback, because I started off, functional neurology. I studied under Dr. Carrick, and I was working with all these different patients, and, really approaching it from a bottom-up aspect, using the sensory motor system, trying to target different areas of the brain with different modalities. But then when I learned more about brainwaves and neurofeedback, I was like, oh, I can approach this more from a top-down aspect. It all impacts each other. We're reading the brain activity from the surface of the brain, but that's generated from deeper structures within our brain that are impacted from all those lower structures. So by combining it with all of our functional neurology treatments, we're really targeting whatever area of the brain that may not be functioning as best as it could from both aspects. And I find that when we combine those together, patients, we get results maybe a little bit quicker. We address some more of those symptoms that sometimes can be lingering after, you work on, how well they can walk and their balance and their dizziness and all of that's doing really great, but they still have a little bit of brain fog and they still have a little bit of anxiety. And it's this last piece of the puzzle. And then when we combine it with the neurofeedback, that's when we can usually really clear up some of those last pieces.
And is this standard, like pretty much any patient who comes in for an intensive is going to have a QEEG and neurofeedback?
Everyone's going to have a QEEG, but not everybody qualifies for neurofeedback because some patients...
They might not need it.
Exactly. So everyone's unique. And so we look at all of their diagnostics together. And, some patients, their QEEG is normal. And so we don't have to address that piece. That piece is working okay. So maybe it's a little bit more of a deeper structure, something else more specific going on that we see that with the other diagnostics. And then that can go the other way around too, where all their other diagnostics look fantastic. And the QEEG is the only piece that we're really wanting to address. So everyone's unique. Everyone gets the full evaluation, but that's really what helps us see all areas of the brain, all areas of the nervous system working together, what's working really well and what needs some help.
So someone watching who is, I see people all the time that they want an fMRI or, the SPECT scan, just for the validation, right? And to be able to show their doctors, like, see, I'm not crazy. So, that alone is like $5,000 without any treatment with it. So someone who is pondering that, can they give you guys a call to get more information?
Yeah, absolutely. I always say I wish everybody could get a QED or a full evaluation, when they're feeling healthy and get a baseline so then I can see you after something happens. But yeah, if you are, I always say, when people are like talking about coming in for an evaluation, we're going to give you one of the most detailed evaluations that you're going to get. And we'll be able to look and say, okay, these areas are working really great and these areas need a little bit of help. And so, they can definitely give us a call. We can run them through an evaluation and really see what's going on.
Mm-hmm. Yeah, well, awesome. And just for everyone watching, the website they can find you guys is neurologicwellnessinstitute.com and also on Instagram, Neurologic Wellness Institute. And all that information is below this video in the notes. And give us a like on this video, leave a comment, let us know if there's something that you learned today that you weren't aware of before. Like me, I learned a lot about neurofeedback today. And thank you so much, Dr. Brenner, for being a part of the concussion discussion.
Absolutely. Thank you for having me.